again, it's tons of patient education. I just tell them that we've been using this device for so many years. All my practitioners are well-versed. We're going to be able to give you the exact results that you want. And we go through that in the entire consult just to make sure that they're comfortable moving forward with it.
I tell them, just try it. You will love the results. So I always encourage people to go to my Google reviews because that is the #1 procedure that gets us a 5-star review on our Google ratings. In addition to that, I personally will never live without Morpheus myself on my own face. And then our before and after photos, we have people ranging from their 20s all the way up to their 80s that get beautiful, natural appearing results. So before and afters and reviews don't lie.
When I mention Morpheus8 to my patients, it's oftentimes when clients come in and they want dermal fillers. And I explain to them that we really need to kind of prep the house first before we build the walls. And oftentimes when we do dermal fillers, we have to wait until we see the tissue rise. And oftentimes the clients end up becoming overfilled, and that's what we want to get away from, at least in today's industry with aesthetic medicine. And so if we can skin tighten first, then you often need less dermal filler. And when I convey that to them, they understand the importance of really prepping the strong foundation of the house, getting that collagen, that elastin rebuilt and firm, and then we can find contour with like dermal fillers or neurotoxin.
I explain it in a way that is microneedling, where you're causing trauma to the skin so that the skin can heal and produce collagen. So if you think about yourself when you get a laceration or a little wound somewhere, your skin tries to repair itself. So same thing with Morpheus. We're utilizing different technologies to help boost that collagen and elastin peak in the skin. So it's trauma causing, but it's worth it.
Well, I think with Morpheus, the technology's there, it's well known, people are aware of it. And again, if the right person uses that device with that individual, understands what they're trying to accomplish and what you can accomplish with that device, I think you can allay everyone's fears with regards to that. You know, a lot of the biggest concerns initially was about pain, and there's always been this misconception, but there are so many other things that you can utilize to decrease pain and to, again, get great results with Morpheus. And if you explain this and spend the time with people, you can allay those fears, and yet they can still see the great changes and benefits that you can get with skin aging and the improvement of such.
Overall, it's a procedure that has very good results, can be repeated over time, can be delegated, so it's a procedure we love.
We do have a lot of experience with Morpheus8 in my office, so I like to think that we're very comfortable with Morpheus8. We see great results with it. We can do it very comfortably. There's really little to no downtime, perhaps a day of some redness typically. So in terms of someone that's just uneasy about it, I think I can reassure them that it's really minimal downtime, and the discomfort is very manageable.
Well, most of the times when you hear patients or anyone that's hesitant about it, it's because they hear about pain with Morpheus. Anytime that you're driving 24 pin needles or 40 pin needles to different levels, and it's also driving some radio frequency, some heat at the tips, you know it's going to be painful unless you do your due diligence at numbing them. So most of the pushback I get from patients is like, oh wow, that's going to hurt. But the truth is that if you prepare your patient properly and you do the right things to numb them, they don't have to hurt. And it's crazy because even the patients that end up feeling some type of pain, although you don't want that to happen, when they get the results, they're still wanting to do more, which tells you how well it's working. But the goal is to make that patient as comfortable as possible, giving them the best expectations, and then doing your job properly. So most of the resistance comes with them hearing, oh, that hurt. But so we as providers have to do a way better job of numbing them and set expectations properly.
I think both of us, we've been providers for more than 15 years. I've worked I'm family practice. My husband's done anesthesia. He works with plastic surgeons. So we get to work on a different level as well, too. We really do sit back, talk to people, take their concerns, really think about it and address it. And honestly, we just go slow. If they're nervous, we just go slow.
Do your own research. You know, don't just go to Google or Facebook and, you know, because what's unfortunate is a lot of people talk about the bad more than they talk about the good on social media, and that's not the area you go. I think we ask them to talk to some of our patients, talk to people who have had the procedure and have had good results, because they do exist. And that's again, you don't see the good online, you see only the bad. But in the end, think about it. Take your time. There's no pressure, there's no rush. Go home, If you have more questions, please come back. We'll do another consultation. Give us a call, email. People text us all the time, patients of ours. We don't mind that, and go over these things over and over again. And if in the end this is not the right treatment for you, then so be it. No big deal. You know, it has to be right for you. You have to be at ease with what you're doing. Just like a surgical procedure, you need to know the ins and outs, ups and downs of it before you actually do that procedure. And we're like an open book. Come in, talk to us. We have nothing to hide. We'll go over everything, and we'll go over it again and again until you are comfortable.
Yeah, I would say almost exactly the same as if somebody comes in and they're hesitant about the procedure, it's what are you hesitant about? What are you hearing? And then when you kind of listen to what they're hearing about, then you can slowly kind of inform them and stuff like that as well. I don't push people into making a decision right away. So if they're hesitant, let me show you before and afters. Let me give you some research. Take your time. Come back and talk to me. And most of the time when people come back and they've talked to me or they've now talked to other people, then they're scheduling an appointment.
So Morpheus8 is something that works really, really well. Specifically for specific patients, I know when I see someone's face what I can do with the Morpheus. All I need to do is explain to them and educate them on what it does, the technology, their safety, all their studies, but most importantly, show them the befores and afters. I get things done, my staff members get them done, my front desk gets them done. Not only do they get them done, but in between patients, they're like, Dr. Lana, can you please Morpheus my face and my neck? So it's something that once they see that we really believe in it, they see our befores and afters, they see befores and afters of all our patients. It's really an easy way to educate them to say, this is something to use in our armamentarium to get you to your goals of rejuvenation, anti-aging, really bringing back the clock. We don't only want you to look younger, feel younger, but we actually want you to be younger. And by building collagen and building elastin, it's actually making us younger. Who doesn't want that?
It is common, and it's a very realistic thing that can occur. So when I sit in the room, I spend a lot of time educating the patients, and I go through the entire consultation. I tell them that this is what my mom uses, this is what I use on myself, this is what my employees use. I show them the results, and I explain to them that there are things to look out for. Sensitivity, it depends on the person. So I would give them examples of what it may feel like, and we start slow. Every time we do a treatment, we start slow, let them see how they like it, and if they are able to tolerate, we continue. So it all depends.